Hi everyone, today I am giving you information on the topic retinitis pigmentosa. It is also known as RP. So let's move to its description. It is a group of progressive hereditary disease which primarily affect the photoreceptor layer and then the retinal pigmented epithelium layer. So it is not a single disease but it is a group of progressive hereditary disease. Hereditary means it get passed on from the generation to generation, and progressive means it keeps on increasing, and it primarily affect the photoreceptor layer. In the photoreceptor layer, the rods and cones are present. Okay, so in the photoreceptor layer, the cones and the rods are present, which gives color vision as well as the night vision to us. So here the rods are more affected than the cones. So here the rods are more affected. Rods gives us the night vision and cones gives us the color vision. Okay, so here the night vision first of all gets affected, and then as the disease get progressive, so the color cones gets affected. So this condition is also known as rod cone dystrophy, because first of all the rods are affected, because rods are more in number. In our eye 120 million rods are present and there are the 2 million cones. So rods are very much more in number, that's why the rods are firstly affected and more affected than the cones. So first of all the night vision of the patient get affected and then the color vision get affected. Next one, demographic features. Now it affects 1 in the 500 people. In every 500 people, one patient have the retinitis pigmentosa. Appears in the childhood and gradually progressive diminished of vision. It appears in the childhood. From the childhood, the patient can recognize that I have a diminished of vision, but it gradually progressive. So we are not be able to identify that when it starts. And progressively, it causes a diminished of vision, blurring of vision, roads affected, cones affected. By the middle age, the patient become completely blind. Okay, so at the middle age, for example 7 to 8 years, the patient become completely blind. Usually bilateral and symmetrical, because there is a role of genetics. As we know that it is a hereditary disease, so usually it affects the both eyes. It is bilateral and symmetrical and almost similar in both of the eyes. If you can see the visual field test, means perimetry test, and if you see the vision of the patient, so there is a symmetrical changes in between them in the both of the eyes. Next one, pathogenesis. Now what is the pathogenesis? Sclerosis of a blood vessels. Okay, so it occurs due to the death of the cells. So sclerosis of blood vessels, as we all know that there are a lot of blood vessels are present inside the retina. So those blood vessels get sclerosed, means hardening. They get hardened and thickened. Okay, due to their thickening as well as hardening, there is no blood flowing to the retina and blood is not flowing to the other parts of the eye. Genetic mutation, mainly rhodopsin gene mutation. It occurs due to the gene mutation. Okay, while the person is taking birth, so mutations takes place inside the gene, so mainly rhodopsin gene affects it. So there is apoptotic damage to the rods and cones and to the retinal pigmented epithelium. Okay, so the retina has the different layers. So mainly the defect takes place in between the photoreceptors layer. This one is the photoreceptors layer where the color cones are formed. Cones as well as rods are present in the photoreceptor layer and the retinal pigmented epithelium. So every defect takes place here. Due to this layer get defected, RPE occurs. Okay, so there is an effective fall in the visual acuity and the visual field. So first of all the visual acuity get reduced and the visual field get reduced. Okay, so visual acuity get reduced, patient can feel a night blindness, and visual acuity keeps on decreasing, and then the visual field keeps on decreasing. Okay, melanin pigment inside the retinal pigmented epithelium get released into the retina and the cells starts to die. So there is a melanin pigment which is present inside the retinal pigmented epithelium layer, which is the last layer. So the melanin pigment keeps on releasing to the retina. When the cells are starts to die, then the melanin pigment which is present inside the retina, it get released to the retina. From this layer the melanin pigment get released into the whole retina. Next one, so there is a release of pigments. Eventually the pigment do not remain free floating in the retina but are captured by the macrophages. All these are accumulated in the inner layers of retina, mostly found around the blood vessels. Okay, so the pigments get released, they will not free remains free floating inside the retina, but they get captured by the macrophages and they get accumulated inside the inner layers of the retina. Those pigments, they are appears in a black color, and these are known as bony specules. Veins are more affected, so the classical appearance, or we can say the sign of the retinitis pigmentosa, is those black things which are present around the veins. Next one is symptom. What are the symptoms? First one is the night blindness. It is an earliest feature. Very earliest feature is the night blindness. The patient can see that he or she is not be able to see at the night time. Visual field changes. First of all, the loss of peripheral vision. Okay. If visual field changes, then the loss of peripheral vision, as degeneration begins in the periphery, because the cones are more affected than the rods, and cones are present at the periphery, due to which the peripheral loss of vision is there. Next one, complete blindness. After first of all the night blindness, then the visual field changes, means the peripheral vision get losses. As a result, there is a complete blindness. Dark adaptation is defected. The person can complain that he or she find it very difficult to adapting dark light after entering from the sun. Means if he is present at the sunlight and then enters to the room, then it creates issues, and he is not be able to recognize very early that where the things are. Okay, so this is a dark adaptation. Next one, signs. What all are the signs which we can identify at the fundus? So by doing the indirect ophthalmoscopy or direct ophthalmoscopy, we can find the signs. Pigmentary changes in the retina. Bony specules appears with the ophthalmoscope and are highly reflective in the nature. Okay, so when we do the direct ophthalmoscope or indirect ophthalmoscope, we can find out these kind of bony specules inside the retina, and these are black in nature and are attached to the blood vessels, and their shape is like bones. A lot of black bones are present, which is a sign of retinitis pigmentosa. Next one is arteriolar attenuation, pencil like thinning of the blood column. The arteries becomes very thin as a pencil, so thinning of the blood vessels takes place, which is the second sign of retinitis pigmentosa. At macula cellophane, macula appears to be stretched out and with the shiny appearance. Okay, so the macula is present here and it appears to be shiny and bulged out. Next one, dusty particles in the vitreous. So pigments which are present in the vitreous can cause inflammatory reaction, resulting in some cases and cause of attraction, causing PVD, and seen in myopic patients. So it is seen in myopic patients, and tractions causing, tractional means the force which is pulling out the retina through the vitreous. So posterior vitreous detachment takes place, and the pigments are present in the vitreous which cause inflammatory reactions. So these are the dusty particles which we can find inside the vitreous. So these all are the signs. Next one is investigation. Perimetry, we can investigate by using the perimetry. How much field of vision is missing? ERG and EOG. These both are the tests we can find out by using the electrical signals, rods and cones, how they are responding. Okay, next one is systemic association. So in 75% cases, retinitis pigmentosa alone occurs. These ocular conditions predisposes to the retinal degeneration. Okay, in 75% cases it is found that it is alone occurs, but in some cases the ocular conditions as well as the retinal degeneration takes place, but in some cases it is also associated with another kind of syndromes and the diseases. So let's see. Ocular conditions are high myopia. If the person becomes high myopic, high minus number, then maybe will be the reason of the in patients having high myopia may be a retinitis pigmentosa, or retinitis pigmentosa may be due to the high myopia. Progressive open angle glaucoma. Okay, so secondary glaucoma is there, open angle glaucoma, and it keeps on increasing. Next one is microphthalmos, in which the size of the both eyes is different. One eye is very small as compared to another eye. And the next one is keratoconus. Okay, it is a corneal disease in which the curvature of the cornea become too steep. Next one is posterior subcapsular cataract, PSC. Due to the PSC, it may also associated with it. So these all are the ocular conditions in the retinitis pigmentosa. Next one is systemic conditions and syndromes. So first one is the vitamin A deficiency. Maybe there is a deficiency of the vitamin A. Liver cirrhosis, a kind of liver disease. Next one is Usher syndrome. It is characterized by RP, retinitis pigmentosa, as well as the hearing loss. So it is a Usher syndrome. Next one is Lawrence Moon Bide syndrome. In this case, it is a rare genetic disorder that affects the multiple systems, including the eyes, kidney, as well as limbs. In the same way, Refsum syndrome is there, Refsum disease, in which it affects the metabolism of the phytanic acid and leading to the RPE and other systemic symptoms. Next one is treatment. Now, first of all, we have to correct the refractive error. We have to give the best correction visual acuity to the patient, BCVA. Next one is provided low vision aids. Okay, so the patient is low vision, so we can provide the low vision aids. Okay, as you can see that this one is the patient, and is not be able to see this sector of the eyes. Okay, so we can use the Fresnel prism. So according the patient is not be able to see the upper region as well as the lower region. So by giving this Fresnel prism to the patient, so it is a kind of field enhancer, so that it can enhance the field of vision, so the patient can see upper as well as the lower area also. Okay, next one is the magnifying glasses we can give to the patient. Field enhancers, as I have shown you. Vitamin A supplementation, some tablets are given to the patient so that vitamin A, which can compete with the deficiency of the vitamin A. Next one are vasodilators. As you can see that there is a thinning of the blood column, so vasodilators are there, so there is a dilation of the blood vessels and blood keeps on flowing, and it will not prevent the disease, but it can keeping the disease, it can delay the disease for some time. Next one, light deprivation therapy. We can give the dark goggles to the patient. Genetic counseling. Genetic counseling is again very important, and no consanguineous marriages. In these kind of marriages, there is a marriage between the blood relations. So as you know that this is a hereditary disease, it keeps on spreading. So this kind of treatment we can give to the patient, and rehabilitation is again very important, because at the middle age the patient becomes completely blind, as we have seen. So counseling, rehabilitation of the parent is again very important. This was the end. Thanks for your patience.